Here we go. Today I've got a very interesting research paper that I found because, I'm going to say, because of my also obsession on finding research that will allow Krav Maga to be better. And since Krav Maga is, I'm going to say, anecdotal, it's really an anecdotal research, or it's very empirical, I've turned myself into other areas. In this case, I'll be sharing with you guys a research paper that it's already in the notes, okay? But it's about the function. The term goes like this. I know it's from karate, okay? And it goes like the following. I find that the term functional and structural plasticity of the brain in elite karate athletes. So, and the reason why I'm looking into this, it's for the following. I know, okay, it's published in the Journal of Healthcare Engineering from 2018, so it's really a very interesting research paper. It compares 13 elite karate athletes. These guys are really elite, okay? These guys have been doing karate for more than 10 years. I've got a definition in here. What does elite mean? So it's not like a study where we see stuff that who is elite is someone that just has a black belt. No. It's very clear. And the elite subject group had practiced karate sport for at least 10 years. And they are performing at least 15 hours of training program weekly. These guys train hard and a lot. They also hold a black belt for more than 8 years. And on the other hand, they also have, okay, here we go. They also had attended the European and the World Karate Championships and achieved more than 3 medals. So these guys are at the top of the chain. Okay, let's put these out there. These are your top MMA athletes. These are your top judo players. These are your top grappling players. These are the guys that not only they train a lot, but they compete at the highest level. So making this very clear. And the reason why I'm trying to go and see what best examples exist, it's because I believe that when we study the best examples from the top, we can pick up things that will work for the average person, if that exists. Okay, and this study was really interesting. And what they would look is they looked into how does your brain changes if you do this kind of elite sport versus a controlled group, and they didn't utilize things that obviously they would be better. Of course, they are better in motor control. Of course, they are. They practice more than the group. Okay. So, but they used what's called measures when the person is in a non-motor control task. They utilized imaging, and they look into how the brain gets stimulus and how does that stimulus work. So essentially, how does the white matter of the brain works, and also the gray matter of the brain works. And I'll put something more in the notes so that this helps us. But here we go. And I want to take us to this because I found this really fascinating. What we can learn from it and what we can utilize for our training in Krav Maga. And again, I'm bringing it down to Krav Maga because that's the art that I practice, but you can use it for your, I'm going to say it's almost independent of the art that you practice or of the subject, if you are able to break it down and understand the concepts. Okay, and that is really an important part in here. I want to go and start by some of the key things that the study has found. Okay, so sports performance seems to be directly related to advances gained through the life. Example: performance difference between athletes who have similar physical fitness levels can be explained with structural and functional plasticity occurred in their brain tissue. In the last decade, with the advances in brain imaging technology, neuroplasticity that occur due to the motor learning or training has been investigated in a large number of studies. The main reason why I want us to pick up this is because we know that over time, as we grow old, our neuroplasticity, a couple of things happen. Our gray matter shrinks, our white matter starts having less quality, so the speed of the connections is less, but we also become, because of this, less able to take decisions, less able to learn movements, less able to execute them. So two different paths. Now, we start having these insights into the brain that allow us to do that. So, and this was very interesting because they picked up 13 people that are this amazing, and I did fight against some of the, I did fight in Turkey, okay, as well, and I think Nunu, that probably will see this as well, will also remember this when we went to Turkey to fight. So Turkey has, this study comes from Turkey, the authors did a great job on explaining this. They do have a proper program in place. They are under the WKF. So this is, from my knowledge of the world of combat sports, real. So it's not something invented in the backyard of someone. And, okay, these guys have the proper group, and they have also the proper control group. Now, a couple of things. It's important to understand that to become an elite athlete, several hours of training is one of their key requirements. Many hours. I think they were. It has shown that changes occur in brain tissue with respect to repetitive performance of the motor exercise lasting in years. So in order to make the changes, you need to last for years doing the exercise. And we'll see my recommendations around what does this mean. Now, in the discussion, the authors come with a couple of things. First of all, they looked into what are the anatomical differences. So, for example, if the gray matter, and you will know the gray matter from the cerebellum, for example, if the gray matter, the exterior, it's not really gray, it's a bit more red, okay, but let's call it gray. If there were changes in the gray matter and in the white matter, changes, so this is, it's measurable. So it's not something like, oh, it changes because of, no, there are effective changes because of this. However, they did not have the initial values for these folks that have been training karate for more than 10 years. So they made a comparison, control group, and the people that attended the study. In this case, the 13 black belts, both men and women. It's important to put this as well there. And they used what's called, moreover, resting state functional responses. And this is really important because it was not in a task. You were still, and they measure when you are still. Okay, that's one of the last non-influence response to whatever is the result. I'll go into the details in here because I think they are fascinating. Okay, anatomical differences between the elite and the control. So we already know that the elite literature points out that the right inferior temporal and the occipital cortex of the gray matter volume decreases in professional video game players and in the patients suffering from addiction of online games when compared to healthy controls. So, another important thing, gray matter, your ability to intake information decreases as you have, if you are a professional video gamer. It doesn't mean that you're not fast enough, but the amount of things that you start being able to learn starts decreasing. So that's really a problem. Its volume loss might be related with the long-term exposure of harmful visual stimuli received from the online computer games. In this case, inferior temporal cortex acts as a gateway for visual perception and memory. What happens is that the visual stimuli is this. So what you are doing is you are reducing the field. An important thing for us as you train martial arts is that you should not only focus on this. That's why every time more, of course, you need focus, yes, but you need to look into what's the environment, where is the exit. It's really key that we don't bring our students only to the craziness of the what's called the tunnel vision. There is more than just a tunnel. Before the tunnel there is a mountain. Sometimes you need to go around in the mountain. So important in here, there is enough evidence in there that if you keep on practicing this, that is harmful for your health. In the concept of these studies, it's unlike that this effects of the visual stimuli presentation increase the gray matter volume as deducted from the elite karate players. So what they believe, the authors, what they believe is that by the fact that they've done many repetitions with precision, with different combinations, allows you to have an increase of your gray matter. Being precise in here. We need to work on motor control. Motor control is precision. Combinations with level changes. Strike up, go down, grapple, go in, but all of them with precision. And you see some people, if you train Aikido or if you train BJJ, sometimes, man, bring the hand in, go there, go here, go there. It's like that thing never stops. And to be fair, I think for self-defense, that's a hard thing, but I understand that it builds up your game, okay? It builds up your control and your precision. Really important to put this up there, okay? So work on motor control and precision, so that allows you that increase of gray matter. Since karate, I'll give you the explanation from the study. Since the karate exercises include the implementation of complex movements that consists of several types of visual stimulation coming from the opponent. Interesting, correct? Because you see the hand coming in, or the punch, in this case the punch, or the knife. This is not an unexpected issue to have premotor control volume increments. You are not an elite athlete, but it's okay. We can utilize this in our training. Again, go back and think about this. Okay, I need to work precision, work combination with level changes, not only on the striking, as I strike, but also changing that, the grappling, to the needed grappling and the coming up. Work with precision. Another important thing is that the study also found that the gray matter density, so it's larger and it's more dense. It's really interesting, correct? It's higher than in the control group. So a person that, and this leads to a whole new thing. Okay, really a very interesting thing for us as humans. A person that has been trained, in this case, it's in karate. I think the same example applies with but going through the protocol of training. A person who is trained and skilled in exercises or learned art may be or have an improved capability of understanding the cognitive and affective profile of the other people. This is what's called perspective taking. So what this is already showing is that not only you have a specific functional approach as you work more precision control based on the effect from the partner, but you are also able to understand more the others. It's a way, okay? It's really an important thing. And another important thing in here is it's to also, and this is a tool that's to place exercises of combat, more chaotic, okay? More chaotic. Combat is completely chaotic, of course. But combat in a non-organized way. Example, someone moves around and they can throw the left or the right, okay? Someone moves towards you and the other can push or he can pull. Someone moves around, they can throw, grab, hit, and you need to be able to perform with precision under this. So these things, not only they give you the ability to physically and spatially understand where these limbs are, but also adequate your response. But now the amazing part that this is bringing is the following, is that because of this continuous plasticity here, not only your gray matter increases, but also it's more dense. So that's really, like, I think, amazing for health, for real health in day to day. The next one that I would like to bring on is the following. Since karate exercises include also the implementation of complex movements that consist of several types of visualization stimulus coming from the opponent, it's not unexpected to see this control of the gray matter being produced. And I want to move forward because there is also, before I give you what I believe is more key in here, the fact that the the authors suggest that the fact that as you try not only to see the attack or to understand what's going to happen, you're also working on prediction. What are the key, I'm going to say, indicators that allow you to see if he's going to swing? Is it because there is a twist in the shoulder, or is it more complex than that? He's going to try to headbutt, or he's going to and try to swing, or he's going to pull up his piece. The fact that you are always trying to build these snapshots with different scenarios and working against these different scenarios brings your also the ability to make sure that your white matter, the thing that makes the connection between the gray matter that picks up the information and makes the decision, and then the transmission with the white matter that has myelin, of course. What it makes it quicker. This is really important, okay? Because later on, things like Parkinson and other things, they affect both. So if we start now with some of the tools that I'm bringing here, for example, work combinations, breakdown, facing on. Okay, one stimulus, post-stimulus. Someone, and I'm asking you to work combinations, not to work single responses, okay? I'll talk about what could be a practice if we are thinking about only one technique. That's a bit less interesting looking at the study. But if you work combinations, if you work the combination of sequences, if you're using other terms, is I give you one stimuli, give you one thing, a grab, a push, and I execute my technique with precision, on time, under stress. We can talk about that. And then also work the post-stimuli. Okay, so work, I give you a stimulus, I execute a certain technique, a defense within the scenarios in here, and then he does something else, and we continue. And it's really important to work these combinations being broken down, okay? Really have time to do this. It increases the ability of your white matter to be, I'm going to call it quicker, okay? Then, so we've talked, these are anatomical perspectives. Stuff is different, really important, okay? So the brain is better. That's how you, let's say it's much more an interesting way to see this. Then they also look into what are the functional differences between the elite and the control, okay? And they compare the two groups, and they already know that it's already known that if you run, your cognitive tasks will have an improvement, okay? And you all know this because the prefrontal cortex has an improvement. But in a recent, there is another study that shows that if you do short-term exercises around 12 weeks, there is also cognitive task improvement. So you are able to look, decide, and execute better. 12 weeks. Okay, so there is in here never even a shorter thing than this. In this case, there is an increased connectivity between the prefrontal cortex and the hippocampus. In the course of this study, they also found the same thing, that they have greater connectivity values, which are in agreement with the literature. Guys, do sessions that promote sequences versus single technique. Simple, correct? And so, or if you have to change and do one technique, you need to give the brain continuous different things in the technique, so that you utilize this short-term approach to build up different capabilities. Again, what I found fascinating in here, and you'll see the conclusion from the authors, is that it can be concluded that the gray matter superiority can be the underlying cause of the differences in the responses. Moreover, gray matter differences can be the basis for neural efficiency gained by regular long-term karate exercise. And I'll change in here the word long-term to karate to Krav Maga, but if you apply the same principles, you can place your martial art in here. I don't know exactly how does this play for only grappling arts, because in grappling we've got the sense of the kinestesical approach that is different from the visual approach. But I believe that it's very similar, okay? Very, very similar. And I will also ask some people that I know from Jiu-Jitsu if this makes sense from them. However, the white matter difference should be analyzed with further measurements. Okay, and this is one of the first studies that really picks up things and shows that if you want a better brain health, martial arts work. In this case, karate works, and I will say Krav Maga works, but with some adaptations in the training. So I know we have a program, we have a structure that says do this, do that, but we need to look into research and see how can we utilize science and research to enhance our students' life, because it's really the most important thing that we can do. I've already shared the links in there. I got more research in Krav Maga for all think, but this is really a fascinating subject that I think